Jodi Halpern is another person. I've collaborated with Jodi for many, many years for the Empathy Project. She is, I'm going to declare her, in my mind, the world's expert on empathy. She has been writing about it for 30 years or more. She's a deep thinker. She's incredibly emotionally intelligent. And go live up to that.
Well, I started 30 years ago when I was in kindergarten. We now know in the doctor-patient relationship that empathy in this attuned way predicts the 3 most important parts of effective healthcare, okay? And I can give you all the studies later. Other people all over the world have done this. First most important part of healthcare is getting the diagnosis right. Patients, all of us, when we go talk to a doctor, we don't just tell them what we're most anxious about. If there's a new lump, if we've been drinking too much, if there's domestic violence, we don't bring it up. We say a little, we give a hint. And only if the doctor is non-verbally attuned do we disclose. And you can say the same thing. The doctor can say the right words, but only when they're non-verbally attuned do we disclose. That's how you don't miss things in the diagnosis. Second most important aspect of healthcare is effectiveness, effective treatment. As many of my colleagues here, I'm looking at James over there, many people know, half of healthcare is not effective because the patient throws the pills away or doesn't take them for long because of side effects. You know this so well, John. And so everything we're doing and spending money on in the health system, 50%, what is the predictor of adherence to treatment? Trusting your doctor. What's the predictor of trust? Does anybody know? Well, it's not directly empathy, but it relates. It's the perception that your doctor is genuinely worried about you. Genuinely worried about you when you're talking about something worrisome, that they're not faking it, the genuineness. Okay, third area of healthcare, dealing with difficult news and decision making, so cancer diagnosis, et cetera, and you have to make difficult treatment decisions and you're really upset and overwhelmed. That has been shown in nonverbal studies, that, in audio taped, year-long, you kind of wire up clinics for a year. The doctors and nurses and patients give permission, but then they kind of get used to it. Nonverbal attunement predicts the patient dealing with bad news afterwards by getting activated to make decisions about cancer treatment much more quickly, to seek treatment, and that can save lives. So medical effectiveness depends on full empathy.
Great.